Hi, this is Danielle Guthrie. I'm a PGY3, and I'm going to be presenting my QI project, which is implementing the Brief Psychiatric Rating Scale, BPRS for short, on the Samaritan Inpatient Mental Health Unit. So the BPRS is a psychiatric symptom rating scale. It's designed to monitor change in symptoms. So each item is ranked on a scale of 0 to 7, so the higher the value, the more severe the symptomatology. This scale has been validated, and certain scores correspond with mild illness, moderate illness, severe illness, etc. So the objectives of this study was to implement the routine use of this rating scale on the unit. And a second objective would be at least 75% of all admitted patients have documented scores on admission, day 2, day 7, and then every 7 days until discharge if they are there that long. And then a third objective is to describe the severity of illness of patients admitted to this unit. The methods include a flow sheet being built into Epic to log these scores. And then first-year psychiatry residents and the inpatient attendings were trained on these systems. And then data from the flow sheet was collected from January 2021 to December 2021. So during that time period, we had 293 patients admitted. And of those 293, we had 74 patients with documented BPRS scores. And you'll see here in figure 2, it says that there are 77 encounters, and that's likely because some of these patients were readmitted and then included in these encounters again. So figure 1 shows the percentage of inpatient psych encounters with these documented flow sheets by month. And we can see April of 2021, there was 94%, and then it kind of tapered. So our goal was 75%, and we ended up with an average of about 38% of patients having their scores documented. And then figure 2 shows how many times the BPRS was completed for each encounter. And we can see the majority had just one time. And then figure 3 shows the severity of illness. So the conclusions are that this QI project didn't meet its goals. It did meet the third goal of assessing what the severity of patients were. So we found out that about 88% are markedly to severely ill and moderately to markedly ill, which would kind of fall in line with an inpatient psychiatric unit. Most of the patients are pretty ill when they're coming in. And then we didn't get scores on 75% of patients. So some reasons that QI projects fail: poor or lack of continued training, poor buy-in, poor communication of objectives, high turnover of staff, and just limited time and resources. So some future implications: the BPRS has been proposed as a tool that can help predict ramifications of early discharge, timeline of improvement, potential for readmission, and insurance companies and health systems increasingly are wanting more standard measurements to monitor symptoms and progress. Psychiatry as a whole is pretty subjective. So those could be some ideas for the future.